Your feet hurt? Nothing seems to help? Hi, I'm Stacy Nash, a licensed massage therapist and yoga instructor, and in today's video, I'm going to teach you how to give yourself or someone you love the best foot massage ever. And stick around till the very end because I'll be giving some extra special tips on plantar fasciitis, sesamoiditis, turf toe, Morton's neuroma, and any other really chronic problem that you've been having. I have some really good tips, and you might not like them, but they really help. So go grab your cozy pants and your favorite lotion and meet me back here. Okay, I'm glad that you stuck around for this video. So I picked up these handy dandy Reflexology roadmap socks. So science has proven that the 8,000 nerve endings on the bottom of your feet are directly related to organs in your body and different systems. And so I'm not going to wear these for the demonstration today, but I wanted to grab them so I could tell you as we're going up certain spots what you're working on. Is effleurage. And effleurage is just, warming up the tissue. So you use your thumbs and you spread the tissue apart. And we'll go ahead and put a little lotion on. And we're just going to start by just nicely warming up the feet. So we'll get our lotion and we'll just spread the tissue apart. And then go all the way up the big toe, all the way up all your toes. The tips of the toes, I always remember our sinus area spots. And so you just spread the tissue apart. And then on the top of the foot, you can just move your thumbs down towards the toes. The top of the foot doesn't have any muscles, so you have to be really gentle on the top of the feet. And then you want to warm up the toes, so squeeze them, squeeze the tips. I hope you can see. Back to the effleurage, and then maybe take your thumbs and go around in little circles around your ankle because those are very important for our hormonal system, even in men. So you just want to do little circles around the ankle and then maybe little circles all the way up the foot, squeezing the toes again. Little circles. And so we're just going to do that, warming it up in little circles until the lotion is absorbed a little, because in reflexology, really need lotion. But the ankle has tendons and ligaments that run like in a triangle. So it's nice to just cross fiber friction those a little with your thumb and here too. And you'll feel sensitive areas. And it's very interesting because and then I'm going to do the other side. You can't really see, but it's very interesting because if you have an issue going on somewhere, like I have a stomach issue, and on the bottom of my foot, right when I get to the stomach area, which is by the arch, it's very sensitive. Okay, now that the lotion is dried up, we're going to start with our reflexology. So the way reflexology works is you put the thumb down and you hook it back towards you, and then you scoot the thumb forward. So you hook and scoot, hook and scoot, hook and scoot, hook and scoot. But when you're scooting, be careful that you don't, because you can very easily separate the skin from the thumb and the nail bed, and that hurts. So you start at the heel, and you're going to make like an army crawl all the way up the foot to each toe. And that is the first step in the reflexology. So we'll start, and it doesn't matter if you go along the inside or the outside first, but we're just going to go all the way up and even into the toe. When I was first learning reflexology in massage school, I learned it on this one day, And I went home. My parents were watching my son, and I went to get my son, and my dad said his back hurt. So I massaged his back a little, and then I had extra time. So I said, let me rub your feet. And so I was just playing around, and then I remembered about the reflexology. And so I went to the spine part on his foot, and I just started digging around, and then I rubbed it a little. Okay, when you do the whole pass, then give a little more effleurage for a second, get fresh blood into that area, and maybe squeeze in between the toes a little, because that helps your body produce white blood cells, which are part of the immune system and go around and attack all the bad things. Okay, there you go. And then go back with the hooking and pulling and scooting. But so, and I was rubbing my dad's feet, and I was pressing on the spine area, and then all of a sudden he said, hey, Stace, when you do that on my foot right there, I feel it in my back where it hurts. And I was like, ding, 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 better pay attention. So hook, scoot, hook, scoot, hook, scoot. The one good thing about these socks, they came with a little tool. And I wasn't sure about the tool, but it does work, hooking and pulling, hooking and pulling. But we're just going to keep using our fingers because that's what we have. All the way up. A little more effleurage. Maybe slap it a little. And then back at it. This time, this is our third and final pass. So when you come to any spot that feels kind of hurty, go ahead and dig around in there a little and see if you can't break that tissue up a little. And if your one thumb gets tired, switch hands. And really no other areas around in here are really feeling affected. And now this time we'll go crossways, just along the foot. And we'll start here. So this is the ear. We already talked about the sinuses on the tip of the toes. This is the ear area, and this is the eye area, and then this is the neck. So we're just gonna hook and grab, scoot, hook, scoot. Now under here is the shoulder, the heart, the lungs, and the thyroid is right here. And then we got the back and the waist here, sciatica here. Right here on the heel is the spot where you would press for insomnia, where the heel meets the foot. You just would dig around in there a little. But let's continue back. We have the adrenal glands. My adrenal glands seem to be not very happy today. And then the large colon and the small intestines in here. And you can always, Google a reflexology map. And then I'm just going to give a little more effleurage, and it feels nice if you bend the toes backwards a little and cross fiber friction this tendon here. especially if your arches hurt or your big toe hurts. There's muscles that all attach in there, and so it feels really good to get in there and dig on those. And then a little more effleurage to get the blood flowing. Slapping, I mean. And there you have it. Now we'll switch over to the other foot, just to be fair. Let's see what we have here. Okay. Hope you can see. It is important though, even though there isn't muscles, there's these tendons here. You could get those nice and worked out. And then the effleurage. Just separating the tissue. I'm going to pull each toe. Okay, and now I'm going to start with my reflexology. Just same thing, stomach spot. Starts hurting in there, but that's okay. We're fixing it. Ooh, what do we hear? Colon. Just hooking and grabbing. Something else in here too. And that's still part of the colon. And a little effleurage. Toes back and forth. And remember, whenever you get to a spot that is a little painful, go ahead, break that tissue up, really stimulate those organs. Work around on my ankle, doing little circles. The whole point with the reflexology is to dig in and pull the tissue towards you and then scoot your thumb a little forward. And just as a side note, you don't even really need to know which organ you're working on. If it hurts, press in it. I mean, I could see how the curiosity would get to you, but okay, there we go. A little slapping. And now, so there you have it, a whole nice little routine foot massage that you can do for yourself or someone you love. One little point, when you're doing it for someone else, it's going to be a little different angle, but you always want to take care of your thumbs. I mean, don't ever, let the pressure bend your thumbs backwards. Try to keep it in a straight line as much as you can. And okay, so let's talk about plantar fasciitis and other foot issues that you have right now or that you might have. And we're going to talk about ice dipping. And I know it sounds awful, But what you have going on in your feet, and it happens everywhere in the body, is so there was like some outside pressure, or maybe your shoes were fitting funny or whatever, and so there became a problem in the foot. Well, that caused inflammation to happen, and then that inflammation causes the brain to send a chemical down to lock up that tissue, to lock up that area, and it keeps happening. So then you walk and now it hurts, and then, oh no, there's more inflammation, more chemical is sent to the area. And so it becomes a buildup of scar tissue or fascia or whatever you want to call it, or in your feet. So like with plantar fasciitis, it comes from the calf muscle being too tight, and it attaches on your Achilles. So, you really need to stretch your calf muscles, and the calf muscle that's really deep can only be stretched if your foot is straight. So this is the first thing to know about plantar fasciitis. The bottom of your feet hurt, but it really comes from your calves. So you want to stretch, and you want to pull your foot towards you, 1,000, 2, 1,000. Point the toe straight, and then pull it back as far as you can again, 1,000, 2, 1,000. So you want to be using your tibialis anterior muscles, the muscle here, to pull the foot this way. And once you get it that way, then you put it on a stretch, 1,000, 2, 1,000. You want to do that about 10 times. And that is really important to do first thing in the morning before you even get out of bed. And then we're going to go up to the ice dipping. And this is good for any issue. Now you have to rub your own feet, and you have to find where those tendons hurt. You can curl your toes towards you a little. I really hope you can see this. And then with your thumbs, dig in and then curl your toes back, and you'll get a really nice deep, stripping of those, and go all the way up the heel. Even massage your Achilles tendon here a little with some cross fiber, but you want to really, really get in there. And okay, so this is one way you could get in there, but you take your thumbs and you try to keep them in a straight line, and you really get in there. And when you feel, ow, it hurts a little, right? But if you're hurting yourself. And then, because a hurt so good is different than an alarming pain. If you are digging so deep you get an alarming pain, well, stop, back off a little. But when you get to that spot that really hurts and you can feel it like crunching in there, then you can hold it, pin and stretch, and really get it moving. And so this should be like just 2 or 3 minutes where you're really digging in there. And maybe you put it like this and you really dig. Maybe you do find some sort of tool, a massage tool, a golf ball, or something that you can really dig in there with. Ooh, that it does get in there. And then after you do that for 2 or 3 minutes, comes the ice dipping. So this is how I ice dip. I have frozen water bottles inside of a bucket or a tub, and I don't have plantar fasciitis or any other foot issues, so I'm really taking one for the team here. So this is how you would do it. You fill up your bucket, and then you stick your foot in. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000, 7, 1,000, 8, 1,000, 9, 1,000, 10, 1,000. And then you come back and you dig in again for 2, 3 minutes. So you want to find the most sensitive areas. A lot of times, one of the sensitive areas is right at the ball of the foot. Right underneath there is where you would pin it and then push your toes back. And that really gets in there. That's pretty hurtful. And then, some really deep stripping. You find a spot, really dig in there, pin and stretch. Try to really get that tissue to break up, and then back into the ice water. And you want to try to do that where you're digging in for 2 or 3 minutes and then dipping in the ice water for 10 seconds over a period of a few hours. You want to try to do it, 10 or 15 times. And it is time consuming, but when you're in pain and you really want to fix it, I'm sorry, that's what you're going to have to do. So thanks for watching. If you got any value, please hit the like button. Please, if you want more tips, subscribe. And if you want to let me know how the ice dipping went, how the foot massage went, I would love to hear from you in the comments. But please remember, kindness is hot in real life, in the comments, and to your body. So go be kind to your body. Thanks for watching.